hospitals are on alert for another possible surge in cases. The Philippine General Hospital has recorded over 20 cases of the highly transmissible Delta variant. Now joining us is PGH spokesperson Dr. Jonas del Rosario. Good morning, Doc Jonas, and thanks for speaking with us. Now, how many patients will the Delta variant have been admitted to the PGH as of the latest, and how many of them have been vaccinated na po?
Okay, as far as the 21 confirmed Delta cases that were reported by the Philippine Genome Center, 8 of those were admitted to the Philippine General Hospital. 2 of them actually died. 1 died in the emergency room and 1 died in the ICU. Of the 6 remaining, 5 already recovered and they have been discharged, and 1 is still recovering in the pay wards. There were 5 healthcare workers who were fully immunized, fully vaccinated in those 21 cases. Fortunately, they were not admitted. They were all reported as mild cases, and so they were not admitted in the hospital. Of the other patients who tested positive, some of them really just used our swabbing site, the OPD PGH swabbing site, and some of them were just referred to the LGU when we found out that they were Delta cases. As to how many got immunized, some of them we still have to confirm, but I have to tell you that those patients who died, the first 2 who died because of the Delta variant, both of them are unvaccinated.
Mm-hmm. Now, Doc Jonas, how can you describe the situation there in the PGH now that we have discovered that there are cases of the more transmissible and deadly Delta variant? Is this still manageable?
It's still manageable. Right now, our numbers are increasing in terms of admissions. Right now, it's recorded that we have 123 confirmed COVID cases admitted in PGH. So that's the highest number so far for the past 2 months. And we're still seeing an increasing trend in terms of admission. So because of it, and we know that the Delta is really coming to PGH, we actually send samples almost every week to the Philippine Genome Center, almost about 30 to 40 samples to be determined. And it takes a while for them to tell us. So there's some delay. But because of that, we just assume that for now, that the cases who come into PGH will be assumed to be the Delta variant.
Doc Jonas, amid the growing number of cases again, is the PGH ready for the possible influx of patients? At sapat na po ba yung equipment and hospital supplies? Is the PGH ready for a possible looming surge as a result of this Delta variant?
We have been preparing for the past few weeks, knowing that there is a possible surge. So what we have done, we included, actually we ordered more equipment. We look into our wards, both in the pay wards and in the charity wards, to improve the ventilation. We have to talk to our healthcare workers with the possibility of them being pulled out again from the non-COVID duties back to their COVID responsibilities. We have leveled up in terms of PPE. We had to obviously increase our supply again to replenish our supply. So as far as PPE is concerned, we have enough. And then in general, we impose stricter guidelines, both applicable to the PGH healthcare workers, patients, and their watchers.
Doc Jonas, I hope you and the rest of our PGH healthcare workers stay safe. Thank you for joining us this morning. PGH spokesperson Dr. Jonas del Rosario.